I was born and raised in Bertie County, moved away for a long time. We came back in 2012 because we needed services for Michael, who has autism and an intellectual disability. It's overwhelming all the time, since COVID especially, but even before that, when he was in a day program 5 days a week, I would get calls at work a lot because they just didn't know what to do. So I thought they need training. So I did a couple of workshops. I had the Autism Society come, but it wasn't what is needed. There's something missing that I haven't quite figured out why we can't get help here. But what we were told as we sought help is that all you're going to find in Bertie County is medication management. What he needs is for people to understand his diagnosis so that they can work with him without creating triggers or making it worse. So if the trigger happens, they know what to do. And that has been the biggest challenge.
Every day that I send my children to school, I want to make sure, I want to know that they're safe, that they're okay. Recognizing that there is an issue in Bertie County, I want to make sure that when my children go to school, that they're surrounded by children who are being helped in any kind of way they can. But I think the behavioral health issue in Bertie County is actually a rising situation. There are a lot of stigmas that kind of pretty much prevents people from actually talking about it, addressing it, admitting that they may have that issue. We're seeing it in the schools, we're seeing it in the elderly community. I
have spent a lot of my career in the Department of Family Medicine at ECU, and they've had for nearly the entire lifespan an integrated behavioral health program embedded in the clinic, and learned early on that medical care and behavioral health care need to coincide, or optimally can coincide and care for people. And so that doesn't exist enough here in Bertie County. And we see, folks in primary care settings, but in school settings, in the Council on Aging here, in various places around the community who don't have good access to both medical and behavioral health therapies at the same time.
What really drew me to the group is because Michael is a consumer of services. He participates with a local agency called Solid Foundation Facilities, and there's just not enough help for us. So we help a lot of other people because we know what they're going through, because Michael is 29 now, so I've been doing this for a long time. He was diagnosed when he was 2, but we don't seem to be able to find help for our own needs. So I was hoping that I could give back to the community by getting the word out about the network, but also maybe get some help for us, particularly for behavioral therapy. I've found that what keeps drawing me back to the meetings, even during the crisis that we were having at home, I would log on to do the virtual, because I just like seeing so many people who want to do something, and so many smart people.
Yeah, I've always loved working with the Foundation for Health Leadership and Innovation, because I've always viewed them as having tremendous insight and capability in terms of identifying need and providing really capable leadership in terms of trying to work directly with communities, and not so much swooping in like we have the answer, but as we've done here with this particular effort in Bertie County, but to try to understand the strength and the resilience and the uniqueness of each community, and to bring resources in a way that they are tailored to the needs, but also to the way people perceive new strategies need to be implemented based on their context and needs as they understand them in their own community.
So we want to figure out what the gap is, and so we talk with people about gaps and needs here and what we can do to close them.
I never had a chance to get involved until Donald and Amelia came, and being able to join in on that group has been a blessing because they actually wanted to bring some resources that would actually help the citizens of Bertie County. FHLI has really helped raise awareness. You know, they really came in, and to me, they've done a great job bringing everyone together in the community.